Hi, this is Dr. Carpenter again. Thank you for tuning in. I'd like to talk for just a couple minutes so that you understand, prior to coming into our practice, what are some of our philosophies around prevention? What are some of our philosophies around preventive health? Before I understood the connections between diet and emotional well-being and disease, what I focused on with my patients mainly was what they could control in the process. I use a software, after having worked with Dr. Russ now for a few years, I understand, you want to maintain great health, you just eat the right foods. And your home care isn't as critical as your diet. But I'll tell you what, we live in a very carbohydrate-rich culture. A lot of the foods that we have that are very available to us are very plaque generating. They're very plaque oriented. So in my practice in our hygiene department, we spend a lot of time trying to help a patient understand how to master their home care. And this isn't delivered like with the Nazi dentist over you telling you, bad, 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 you've done bad. This is a software that's designed to help us stay in adult-to-adult interactions with our patients. And again, it's a process that's done with respect to patients' goals. In order to help explain what we do and how we try to track people's preventive potential at home with respect to local, keeping local irritation down, which is your home care, I made a little diagram here that I want to kind of explain. Because the wild thing is, as I started meeting with patients and talking to them about periodontal disease, which is the most common disease on the entire planet, by the way, and it's totally preventable, I never had a patient who ever understood what gum disease was. And these would have been maybe the 70-year-old woman who had surgery 3 times and is now on top of it. Or the guy who had a grafting done because his gums receded. Not one person ever understood or had a doctor explain to them how periodontal disease works. The only one person I ever had that came in understanding it was a very loving patient who had a lot of cats. She took her cats to the vet, and the vet actually did a good job explaining gum disease to her so she could prevent it in her cats. I'd like you to be able to understand this information. This is a free gift, and what I'm about to tell you will literally be able to help you prevent the majority of oral disease related to plaque that occurs in the mouth, which is a lot. It's decay, it's gum disease. I drew a couple molars here. This top line represents the gum tissue. And what happens, as creatures that need foods and things to rebuild ourselves all the time, we're always eating and swallowing and chewing. When we chew things up, and I'll use green to kind of represent plaque, but plaque is not green, and it's almost invisible in the mouth. But you'll see a couple places where plaque will want to catch consistently. One is at the gum line of teeth. One is in between teeth. And these are just little nooks and crannies in our mouth where food can trap whenever we're chewing it up, and it's what doesn't get swallowed. Food in our mouth is food for bacteria. So what happens is when you have food plus bacteria, that's what plaque is. Food plus bacteria, and everybody's got plaque. It's forming on our teeth 24 hours a day, all the time. The only thing we can do to try to limit its damaging impact is know, through communication with a conscientious provider or coach, how to control it. So when the bacteria in the plaque start using that food as a food source, what happens is they have a metabolic process just like us. They eat foods and they produce a waste product. The types of waste products that oral bacteria produce a lot of times are acids. So this becomes a problem. If a person leaves plaque around most of their teeth most of the time, they will have a very acidic environment in their mouth. Believe it or not, the mouth and the teeth in the mouth function on pH, or acid-base levels. We know at a pH called the critical pH of 5.5, teeth start to dissolve. So in order for us to try to prevent teeth coming apart and the need for restorative things, we want to try to maintain an optimal pH environment in our mouth. The only way we can do that is by controlling bacterial acids. When bacterial acids are produced and they sit against our delicate gum tissue, you got to remember this gum tissue is not like the skin on our arms. It's not keratinized. It doesn't have a barrier to microorganisms the way our skin does. Bacteria can move through gum tissue. When the acids from bacteria in the mouth sit against gum tissue, after 48 hours, which is 2 days, the body starts to respond. And people know how the body responds. The body responds by swelling. These are the cardinal signs of inflammation in a human body. You have swelling, you have redness, you have discomfort. And that's what happens with the gum tissue. As gum tissues swell, you can almost imagine them being like a balloon. The balloon's getting bigger and bigger like it's going to pop. It takes very little trauma to gum tissue to get it to bleed when it's been exposed to bacterial acids for a long period of time. You can eat a corn chip. You can bite into a sandwich. Anything like that can generate oral bleeding. Whenever you bleed in your mouth, all these bacteria, all the toxins, the poop, and all the stuff that they produce, it all goes directly into our bloodstream through our infected gums. And it's a terrible situation that's completely preventable. In our office, we have a software called Dental Fitness that I'm very happy to use with patients because it's one of the only tools that I've ever seen that actually makes people get healthier. But in the process of delivering a dental fitness exam, we'll document with a patient, overall in their mouth, what was their percentage of plaque? We give them a score. What was their percentage of bleeding? We give them a score. We graph these things in the mouth according to health or disease. And we've just found that it's a very effective way to communicate with people on an adult-to-adult level to help them to understand what needs to be accomplished at home. Our hope for our patients and for having optimal health is to be able to maintain an oral environment that's conducive to health. So, in addition to a good conscientious exam and good therapy, we've got some certain philosophies in our preventive department. We don't believe in using any fluoride therapy. Fluoride was something that I gave a lot of my patients before I learned the truth about it. Fluoride can cause problems with your thyroid. Fluoride can cause skeletal developmental problems and sarcomas in boys. Fluoride is not a healthy material to have in your body. And you don't have to fluoridate teeth in order to keep them from decaying. You can do it by communicating with your patients about what's causing the disease. So we're strictly fluoride free. We're gluten free in all of our pastes, and all of our products are completely natural. Some of the interesting things that I've learned about naturally based gum products is they're very effective. These products, unlike antibiotics or things that men make in order to try to retard bacterial growth, natural essential oils, natural phenols, and these things that God gave us, bacteria can't form a resistance against. So we use completely natural products, not because we're trying to be like hippy-dippy, but because we want like really good results. We want our patients to have good health. I'd say 70% of the emergencies that I've had walk into my office are related to people who have changed their products. They got the inexpensive product that was on sale, and they've got a terrible rash in their mouth as a result of it. They're contact dermatitis types problems associated with all the unhealthy chemicals in toothpaste and mouth rinses that we have today. So I very much appreciate you tuning in to listen to this. This is a component of my practice that is so important to me because it's not about the gum. It's about what we're doing for the organism to keep them in a healthy place. The more you can master your home care and your plaque control, the fewer dental procedures you'll need. And that's what everybody's wanting. We're wanting to honor and preserve the body as much as we can. And in order for us to do that, we have to have an approach on a daily basis that helps us reach that goal.